The CDC FAQ and the WHO disease outbreak notice landed on the same day. So now we can ask, do these two institutional documents actually answer anything, or are they just the official-looking version of what we've been waiting for? If you're just joining us, a cluster of Andes virus cases, not sin nombre, not Seoul, has been linked to a cruise ship. Passengers dispersed across at least 23 countries before the first confirmed case was reported, triggering multi-country contact tracing across the EU and beyond. 7 people in 5 U.S. states are being monitored. 1 passenger has been in quarantine for over a month. Spanish authorities are now in the picture, with the ship last reported heading toward the Canary Islands.
This is Hantavirus Watch. Today, the WHO and CDC both put out formal guidance, same Tuesday, and I want to know if they agree, if either one accounts for people leaving the ship before anyone knew there was a case, and if the person sitting on a contact list right now gets a treatment answer or just another pamphlet. Let's find out. Follow the show, and the next briefing lands in your feed on its own.
Centers for Disease Control and Prevention writes,
Andes virus is a type of hantavirus that can cause severe respiratory disease in people. It is not a new virus and is normally found in areas of South America. Hantavirus disease surveillance in the United States began in 1993 during an outbreak of severe respiratory illness in the Four Corners region, the area where Arizona, Colorado, New Mexico, and Utah meet. From 1993 to 2023, a total of 890 cases of hantavirus disease were reported in the United States.
Okay, the CDC FAQ is finally a document I can read instead of describe. Andes virus, severe respiratory disease, normally a South American bug. So now let's see if it actually answers anything.
The framing matters here. We're talking about Andes specifically, separate from sin nombre, the strain behind those 890 U.S. cases since 1993. Different rodent reservoir, different geography.
Right, but here's my problem. The whole reason Andes is the headline is person-to-person spread. That's why we're contact tracing across countries. Does the public FAQ tell someone on that contact list what to actually do when they spike a fever? Or does it stop at the clinic door again?
It tells you what Andes is, and it says CDC has outbreak experience. But a therapeutic trigger? That's what you've been chasing, and the FAQ stays pretty general.
So a monitored passenger in one of 5 states reads this, gets a fever on day 38, and the instruction is basically, watch for symptoms. That's the non-instruction I've been circling. There's no antiviral to reach for, no clean, go now threshold.
Give the document this. There's no licensed antiviral for hantavirus, so it can't point to one that doesn't exist. The honest answer is supportive care and early ICU involvement. The FAQ could say that more plainly.
And one more thing I'm watching. This drops the same day as the WHO notice. I want to know if the geography lines up between them, or if there's daylight on who's actually being traced. So let's go there next.
Here's what the World Health Organization is reporting.
So the WHO disease outbreak notice and the CDC FAQ both land today, and my first question is whether they even match on the geography. We just heard the CDC FAQ treat the ship as Andes virus ground zero. Does WHO draw the same perimeter?
Dawn 600 frames it the same way. Andes virus, person-to-person, cruise-linked. And crucially, the WHO notice includes the post-disembarkation window, contacts who'd already left the ship, not just people still aboard.
Okay, so WHO is saying the perimeter walked off the gangway. That leaves the CDC document sounding narrower, like the ship is still the box.
I think that's audience more than fact. The CDC FAQ is public-facing reassurance. The WHO Dawn is the formal multi-country tally. And that tally tracks the same 23-country dispersal the EU flagged June 12th, not a smaller number. Here's Matt Bodner at NBC News.
The cruise ship at the center of the hantavirus outbreak is heading toward the Canary Islands in Spain. Contact tracing is underway in multiple countries, including the United States, after passengers left the ship before the first reported case.
So NBC's Matt Bodner confirms the thing I've been chewing on all week. Passengers walked off this ship before the first case was ever reported. The ship was never the perimeter.
Right, and that's what the multi-country tracing is built around. People who dispersed before the first case was reported. NBC says it's active across multiple countries, including the U.S.
Okay, but here's my problem. We just heard the CDC FAQ and the WHO notice. Does either document actually acknowledge that dispersal window? Or are they still drawing the circle around the boat?
The WHO notice treats it as a multi-country cluster, so the geography's in there. But the public-facing CDC page still doesn't tell a contact exactly what to do when the fever hits, and Bodner doesn't close that gap either.
And now the ship's steaming toward the Canary Islands. That's a new jurisdiction, Sarah. Are Spanish health authorities even read in on a 23-country trace?
NBC doesn't say. It names the destination and stops there. For today, the Spanish piece is still unanswered.
If you're tracking hantavirus risks, you might also like Food Recall Watch, daily FDA and USDA food recalls, allergy alerts, and outbreak-linked notices, from salmonella and listeria to pet food advisories. Find it wherever you listen to podcasts. We've put links to all the stories from today's briefing in the show notes, so if one caught your ear, you can dig into the original reporting there. That's Hantavirus Watch for today. This is a Lantern podcast.